Hi, my name is Susan Wilson, and I'm the author of Women and Children First, The Trailblazing Life of Susan Dimock, MD. We are at the Dimock Center in Roxbury. The Dimock Center is formerly the Dimock Community Health Center, and before that, the New England Hospital for Women and Children. Back in 1862, a pioneering woman named Dr. Marie Zakshevska opened this hospital as the second hospital in America run by women doctors for women. And that was profoundly unusual at the time. And her star pupil was a woman named Susan Dimock. She actually studied at the hospital with a doctor as her mentor. And then they collected money and sent her over to Zurich to go to medical school, because the medical schools here, the high quality medical schools, would not accept women. And she studied in Zurich, got honors, did some more studying in Vienna and Paris, and came back. One of the things that had impressed Susan Dimock while she was in Europe, because healthcare was far more advanced there than it was in America in the 19th century, is nursing. She actually met Florence Nightingale. She went to the school where Florence Nightingale had studied and learned about nursing, and came back convinced that nursing was kind of like a very low class kind of a vocation that only desperate women or people of lower means would even think about doing, and she wanted to make it a professional thing. So there was a little bit of a nursing program here, very casual. Susan came back and really professionalized it. She made it a year-long course. She invented a series of lectures where various doctors would talk about different subjects. She divided it into quarters so that the nurses could have very specific things like learning about nursing at home, nursing at night, nursing in surgery, and so divided it up that way with the best people coming in possible. And she really professionalized it, and this is considered the first professional training in the United States. Susan even trained the first trained professional nurse in the United States, a woman named Linda Richards, who wanted to study nursing, came in one day, and Susan talked to her and said, "You're going to be my very first student." And they assembled finally within the month. This is back in 1872. Within the month, they got 4 more students and started very seriously. These images all happened at the New England Hospital. However, they are after Susan. At the time when Susan was beginning to do surgery and working with these nurses, there were no uniforms, there were no sterile gloves, there were no masks, there were no, all the modern things that we think about and identify. This is all about 20 years after Susan, when these nursing classes came. But she instituted this. And it's very funny, at the end of the year, she had really worked these women to death. In fact, several times, Linda Richards had to come to her and say, "You know what? We can't work 18-hour days and then sleep for 3 hours and be in the rooms between 2 patients and help them all night and get up in the morning. You've got to lay back." Susan was tough. She expected a lot out of herself and expected a lot out of all the people who worked under her, including the nurses. So she lightened up, made it a lot more amenable. And then one day, after a year, she invited Linda Richards into her office. Linda Richards had no idea why she was there, and Susan sat down at her desk, reached into the drawer, pulled out a rolled piece of paper, and handed it to Linda. And Linda said, "What's this?" And Susan said, "It's your graduation certificate. You've just graduated." And Linda went, "Oh," and then walked out. So it wasn't the finest moment, but it was the first trained nurse in the United States, and something that was followed and emulated by hospitals all across the nation after that.